Word on Health, the report with its finger on the pulse of popular medicine, with Paul Pennington. Word on Health, for your very best of health.
It's our fifth biggest cancer, with around 19,000 cases diagnosed across the UK each year. The charity Fight Bladder Cancer was set up by bladder cancer patients for bladder cancer patients so that no patient feels alone in their bladder cancer journey, as Dr Lydia Makaroff, CEO of the charity, explains.
What we've found is 50% of people who are sitting there in the doctor's office and they hear the words, "you have bladder cancer," half of them have never heard of the disease, and over 70% of them don't know anyone else who has bladder cancer. So it can be a very isolating disease. We want people to know that there is support out there. And we also want people to know the signs and symptoms. The earlier that it is caught, the more treatable it is.
So what are the signs and symptoms?
The signs and symptoms can differ between men and women. For men, it's blood in pee, it's urinary tract infections, it is sort of back pain or any changes to the urgency or frequency of urination. With women, we see a lot more of what appears to be urinary tract infections. And this is tough because often they might go to their GP or family doctor and they might just be told, "Oh, it's just a UTI, I'll just prescribe you some antibiotics." But we say to all women out there, if you're having repeated what looks like UTIs, ask to be referred to a specialist just so they can rule anything out.
Is bladder cancer more prevalent in men or women?
It is more prevalent in men. We see about 3/4 of the case in men and about 1/4 of the cases in women.
What are the risk factors?
If you're older, if you're a smoker, and also there are certain professions that put you at increased risk as well if you've been exposed to certain cancer-causing chemicals. So if you're in the petroleum industry, if you're in the textile industry, if you're a hairdresser or if you're a nurse, you might be at increased risk.
Bladder cancer is thought of as something of an older person's condition. Does that cause a barrier for younger people to get diagnosed?
Our global surveys have shown that younger people actually have more delays to diagnosis than older people because of this issue.
Where are we at in terms of treating bladder cancer?
Bladder cancer cannot be cured, but it can certainly be treated. And we have a wonderful community of many people who've lived for decades with a diagnosis of bladder cancer. So it's certainly a disease with a lot of hope. There's two different types of bladder cancer. There's something called non-muscle invasive bladder cancer, which is where it hasn't invaded the muscle of the bladder. And then there's something called muscle invasive bladder cancer, where the disease has invaded the bladder. And so if you've got non-muscle invasive bladder cancer, the treatment is generally directed into the bladder itself. The particular chemotherapy or immunotherapy is actually inserted through a catheter. And this can be very helpful because it means that you are actually able to reach and target the tumor itself without perhaps having the typical chemotherapy side effects that you might have if your chemotherapy was via an IV. If you've got muscle invasive bladder cancer, there's different options. The two main options are either surgical removal of the bladder, and then you just have a bag, or you have an artificial bladder, or radiotherapy, where you have specific targeted radiotherapy to your bladder. And we're also seeing exciting new clinical trials with more treatments as well. And the healthcare professionals are very well equipped to talk to your family, and come up with a treatment plan that suits you and your lifestyle and your preferences.
Alongside raising awareness and being less isolated, what are the challenges that patients tell you that they'd like to see overcome?
There's not always a talk about all of the side effects of bladder cancer. Perhaps we might be a little bit hesitant to talk about the sexual side effects. Perhaps we might be a bit hesitant to talk about body image, and living perhaps with a stoma bag on the outside of your body instead of a bladder on the inside of your body can be a big change to your lifestyle as well. There's definitely a lot of stigma, and I think if we have more conversations and more communication about bladder cancer, then I think that can really open people's minds and improve outcomes.
My grateful thanks to Dr Lydia Makaroff. To find out more and link through to Fight Bladder Cancer UK, visit our website, wordonhealth.com. That's wordonhealth.com.
Word on Health, for your very best of health.
Research shows that sight is the sense we fear losing the most, yet many of us don't know how to look after our eyes. Louise Gow is clinical lead for eye health and low vision at the RNIB.
We know that around about 2 million people live with some level of sight loss. We estimate up to about 50% is avoidable. And in that category would be people that haven't come forward for treatment, or who haven't had routine eye examinations and have missed the chance for treatment. There might be people who don't know how to use the the healthcare system in the UK, or who have concerns around wearing glasses when they were little, so perhaps they didn't have an eye examination when they were young, and that meant that they developed an amblyopic or a lazy eye. And then there are groups of people who find having an eye test very difficult, so people with learning disabilities and perhaps who don't have English as their first language, they miss the opportunity for treatment.
Are there particular groups of people who are more at risk of sight loss?
In your lifetime, you have a 1 in 5 chance of having sight loss. And as you get older, with each decade, that increases. So by the time you're 90, you have a 1 in 2 chance of having sight loss. If you are from an ethnic community, then you're more likely to have sight loss. You're more likely to have diabetes and glaucoma. Those are 2 big causes of sight loss. If you're female, 2/3 of the people on the registration for sight loss are female. People with learning disabilities are 10 times more likely to have sight loss. If you're a child with learning disabilities, you're 28 times more likely to have sight loss. And another group that's perhaps worth mentioning here are people who don't have a fixed address. Homeless people often have sight loss that could be avoided and don't have access to eye care so easily.
What steps can we take with regards to diet, exercise, lifestyle factors, etc., to contribute to better eye health?
So anything that is good for your heart and your brain is good for your eyes. So managing your weight, managing your sugar levels, if you have diabetes, managing your diabetes, your blood pressure, all of these things increase your risk of sight loss. If you smoke, you are twice as likely to have sight loss according to the statistics. You'll see some vitamin supplements on the shelves in the pharmacies. There's no evidence to suggest that taking those supplements will stop you getting sight loss. There are certain groups of people with established eye disease that do benefit statistically from those supplements, but taking them will not reduce your risk of sight loss. But a good healthy diet, what they call a rainbow plate, lots of colourful vegetables, will do your eyes the world of good.
Why are regular eye checks important?
Firstly, because way too many people live in the UK with cataracts and with ageing conditions such as just simply needing reading glasses that are not corrected. But more importantly, there are a number of eye conditions that are silent, if you like. So you don't have obvious symptoms of them, and they will be picked up in a routine eye examination before they've done any damage. Glaucoma is a classic example. That is caused when the pressure goes up in the eye and that damages the optic nerve. But it's not until it's quite a late stage that you will have symptoms of that. So having a routine eye examination will pick up glaucoma before it's done any damage, and then it can be treated and controlled. Diabetes as well, you can have quite a lot of damage at the back of the eye from diabetes before you're aware of it, and then the treatment is much harder. And for children, there's a lot of myths around eye care for children, that wearing glasses makes your sight worse and that sort of thing, but actually it can prevent a lot of sight loss that's as a result of developmental change. So for instance, if you have a squint or a lazy eye, one eye that's more long-sighted than the other, if that's treated before you're around about the age of 8, then you can prevent a lazy eye from happening. So getting the children in for routine tests is just as important as having an eye test as you get older. We recommend an eye test at least every 2 years, and more frequently if you have certain eye conditions like glaucoma or if you're diabetic, and your optometrist will tell you how frequently you should attend for an eye test. But a good average is every 2 years.
My grateful thanks to Louise Gow. For further information on this story and links through to the RNIB, log on to our website, wordonhealth.com. That's wordonhealth.com.
Word on Health, your personal prescription for your very best of health.
Recent research indicates that about 1 in 20 of us has some kind of a thyroid disorder, which may be temporary or permanent. Although, as a not insignificant number of people are unaware they have a thyroid disorder, the true number of people living with one is unknown. Julia Priestley is from the British Thyroid Foundation. Julia, to start with, what exactly is the thyroid?
It's a tiny butterfly-shaped gland which sits at the front of your neck, just below the Adam's apple, and it produces hormones. They're responsible for all your physical and psychological processes.
How can people be unaware they're living with a thyroid problem?
The symptoms can be missed because they can be quite general and mistaken for other things.
So, who is more likely to develop thyroid disorders?
They affect mostly women and older women, often at the time of the menopause, and a woman might overlook the symptoms thinking it's down to the menopause or just generally getting older. They also affect younger women if you've got a history in your family of thyroid problems or other autoimmune diseases. That's another reason to indicate that you may develop one yourself. They do affect men and children and young people as well. Even babies actually can be born without a thyroid. Men often will be missed because they don't expect to get a thyroid disorder, and perhaps their GPs aren't expecting to find a thyroid disorder in a man. It's always worth chatting to your GP whether they think that you'd be worth testing, because blood tests are usually the best way of confirming a thyroid disorder or not.
Talk me through the symptoms of the most prevalent thyroid disorders.
It's likely that you'll have some physical symptoms in some way, or psychological ones as well, and psychological ones are often overlooked. The most common thyroid disorder is hypothyroidism, which is an underactive thyroid, and that's when your thyroid gland doesn't produce enough thyroid hormone, and it slows your metabolism down. You'll commonly feel enormous tiredness and fatigue, but even good sleep doesn't help. People talk about brain fog, not being able to think very clearly. People experience stomach upsets and constipation. They often will gain weight, experience hair loss and dry skin and brittle nails. And then an overactive thyroid is where, conversely, your thyroid works too hard and produces too much thyroid hormone. Body speeds up. Some people talk about feeling like they're plugged into the grid, they're buzzing, and experience heart palpitations. They can feel hot and sweaty, thirsty. Muscle aches as well, actually, for over and underactive. They get shaky hands and they find it hard to relax and can have sleep problems, and they'll often lose weight. So underactive thyroid, you gain weight, but with an overactive thyroid, you lose weight because your body's just working too fast, burning through the energy. There are other thyroid conditions as well, which is important to mention. Many of us will have thyroid nodules or goiters, which are lumps and swellings on our thyroid. A lot of us will have them and not even know we've got them, and they won't ever cause a problem to us. But sometimes they become noticeable, so you can feel a lump. Perhaps one of your friends or family members might spot it on your neck, and then sometimes they'll affect the way we can swallow and breathe, or they cause voice changes. While fortunately most thyroid lumps and bumps are benign, they should always be investigated.
Thyroid disorders can lead to severe health problems and need to be treated quickly. If we are diagnosed, what steps can we take to live well with thyroid disorders?
There's no magic thyroid diet. I wish there were, because weight management is a problem that a lot of people in our community have. We would just advocate a healthy, balanced diet. There are no particular special vitamins and minerals that people need to take. So really the most important thing is to take your medication regularly and to look after yourself, to be kind to yourself, to know that you'll have good days and bad days, and talk about it as well, because there are other people out there who are affected and will understand. So it's important to reach out to those if you're feeling alone.
My grateful thanks to Julia Priestley. To find out more and to link through to the British Thyroid Foundation for help and support, log onto our website, wordonhealth.com. That's wordonhealth.com.
Word on Health, for your very best of health.
According to the World Health Organization, anxiety disorders are the world's most common mental health disorders. UK experts suggest around 1 in 5 of us at some point in our lives live with or experience anxiety. 1 in 10 will live with a disabling form where it seriously impacts on their day-to-day functioning. Dave Smithson is from the charity Anxiety UK.
Some people will be able to manage it themselves with self-help tools, self-help technique. Those at the mild end of the scale, at the sort of moderate end, you might need to have a short course of therapy or a short course of medication. And certainly on the more severe cases, the more complex cases, it may be that you need a longer period of therapy and medication, or a combination of both.
Dave, everyone can feel anxious sometimes, but people with an anxiety disorder often experience fear and worry that is both intense and excessive. When should we be reaching out for help with anxiety?
You're not able to control it yourself through self-help means when it's starting to have that day-to-day interference with your normal ability to function. That's the time to reach out and get some professional help.
We hear about long waiting lists to receive in-person care for mental health conditions, which can put people off from getting the help that they need. But I understand that the growth in online services has proved to be really helpful for the members of the charity that you represent, Anxiety UK, to receive therapeutic support.
Apps in particular, mindfulness apps, meditation apps, things like Headspace is the one that we work in partnership with, and we provide subscriptions to our members. I think the delivery of online services has undoubtedly been helpful. Had we not had the facility and the ability to deliver therapy support via an online platforms through either our therapy on demand service that anybody can access, or for our members, we've been able to meet the growing and increasing demand for it.
And finally, Dave, what self-help tips can you provide to help us manage anxiety?
Simple things such as diet and exercise are hugely important. Exercise is good for our mental well-being as much as it is for our physical well-being. There's lots of research evidence that show there is a direct link between your gut and your brain. So eating healthy is hugely important. And then the other thing I'd very much encourage people to do is do some kind of mindfulness activity or hobby that can distract you, that can take your mind off that ruminating and worrying about things. You're so focused on what you're doing that you just don't worry about things. Try making sure you get a good night's sleep. Sleeping is really important. If you're not unwinding enough before you go to bed, to make sure that when you go to bed you get a good night's sleep. Try and plan around maybe having a hot bath before you go to bed, or a Horlicks, Ovaltine, those kind of drinks. Something that helps you bring your heart rate down before bedtime so that you're relaxed and ready for it. Those are a few things to consider. On our website there's some resources that you can download. There's a breathing and anxiety tips book, there's a stress and anxiety book. They're full of tips and advice, so have a read of those.
My grateful thanks to Dave Smithson. To find out more and to link through to Anxiety UK, visit our website, wordonhealth.com. That's wordonhealth.com.
Keeping you in touch with the health and lifestyle issues that matter. This is Word on Health with Paul Pennington.